So hi everyone, I'm Karen, and I won't go through everyone's name because for timing reasons, but you can see the name of the team that were involved in developing this e-learning on the slide. Next slide, please. So just as an overview of what I'll cover, I'm going to really quickly run through the background to why we developed the e-learning, as Justine has very comprehensively discussed this. I'll give you a brief overview of how we developed the e-learning, a few findings from the research that underpin the e-learning, but I won't go into this into too much depth because there was just so much that came from the research. I'm then going to go through the structure of the e-learning, and I'll share with you a video clip. And I then have some slides on kind of some practical stuff about how to access the e-learning. Next slide, please. And so as Justine mentioned, this was very much a multidisciplinary partnership with academic, NHS, public health and charity partners, and it was funded through Health Education England. Next slide, please. So Justine has already gone through this in a lot of detail, but we know that adults with learning disabilities die on average 20 years younger than the general population. Next point. Next point, please. And just under half of these are avoidable deaths, with heart disease the top cause of avoidable death. Next slide, please. We know, as Justine showed us all that data, that adults with learning disabilities do have a higher risk of obesity. Next point, please. And addressing obesity is really a key priority to reduce avoidable deaths. And the Nuffield Trust, in fact, published a report last year highlighting obesity as one of 5 key areas of focus to close the gap of health inequalities. And within this, there were a number of recommendations that were made, one of which was the need for consistent training of health and care professionals. Next slide, please. As Justine has also highlighted, we know that carers are really important to help people with learning disabilities make changes to their lifestyle. This has been shown in the research literature as well. And it was highlighted that there was a lack of training for carers on how to actually do this. Next slide, please. So the overall aim of this project was to develop free, nationally available e-learning for carers on supporting healthy weight in adults with learning disabilities. Next slide. And so I've got quite a few methods. You can just probably put them all out now, yeah, and I'll just go through them individually. So there were 6 main steps to this project. So firstly, we reviewed key online and written professional resources that were already out there to promote healthy weight in people with learning disabilities. We then undertook qualitative interviews with health and social care managers, clinical leads, and commissioners to identify key carer barriers in supporting healthy weight in people with learning disabilities and identify areas that should be included in the training. An initial draft version of the training content was then created, and we then discussed this in discussions and focus groups with paid and unpaid carers to then refine the training. And finally, we worked with the NHS England Technology Enhanced Learning team to design and build the e-learning. And the 2 arrows on the right, I'm just going to show you a few, or the 3 arrows on the right, I'm going to show you just a few findings from these steps. And I'm going to show you how the final e-learning is structured. So next slide, please. I just also wanted to mention that during this project, we collaborated with the Brandon Trusts, specifically with the Brandon Adventurers, who are a panel of experts by experience. And we worked with them to create lived experience videos that are included as part of the training. And I'm going to show you one of those videos at the end. Next slide, please. So there were a total of 25 individuals who took part in our research, and that was across 19 interviews and 2 focus groups. We had quite a range of participants. So the biggest group included social care managers, but we also spoke to healthcare managers, paid and unpaid carers, both NHS and local authority commissioners, a public health professional and social enterprise staff. And we had people from across the Southwest, from both urban and rural areas in the southwest. We also had some individuals from the northeast of England and 2 individuals who held national roles. Next slide, please. So some of the themes that came out from this qualitative work, from these interviews and focus groups, were around the challenges for healthy weight in adults with learning disabilities, how to define success in terms of weight in people with learning disabilities, the role of carers in supporting healthy weight and the challenges that they experienced, as well as carer training needs. And I have previously presented on these themes, and just in the interest of time, I'm not going to focus hugely on them. I'm just going to show you a bit more information on number 4, the carer training needs. So next slide, please. So there were 3 key areas that were highlighted in terms of the training needs. So firstly, it was felt to be important to start off by presenting some simple facts and figures about the health inequalities in people with learning disabilities and just how obesity impacts on health, because it was felt that this actually wasn't well known. And secondly, the basics of healthy eating and physical activity. Again, it was felt that the carer population, and in fact the general population, don't have a great understanding of these basics, and so this then doesn't get passed on to the people who are being cared for. And next slide, please. And then finally, drawing both of these areas together to think about how to apply this knowledge when supporting a person with a learning disability. Next slide, please. So this is, I just want to show you the structure of the e-learning. So those 3 main areas of need that we identified is how we actually structured the e-learning into 3 bite-sized, roughly 10-minute sessions. So the first one is entitled Overweight and Adults with Learning Disabilities. The second one is the basics of healthy eating and being active. And then the third one is more of that practical stuff. How can I support an adult with a learning disability to eat more healthily and be more active? And within each of these sessions, we have a roughly 2-minute lived experience video that's embedded within each. And I'm just going to go through each of these and just show you a screenshot from each of these sessions next. So next slide, please. So in the first session on overweight and adults with learning disabilities, the topics that we cover in this are what overweight means and what causes weight to increase, why it's more common for people with learning disabilities to be overweight, and why it is important to support adults with learning disabilities to work towards a healthier weight. Next slide, please. This is just a screenshot which the amazing team at NHS England Technology Enhanced Learning developed. It just shows you there's lots of colourful images. It's not just text. It's really well designed. Next slide, please. And so the second session was around the basics of healthy eating and being active. And so within this session, we cover the different food groups, why they're important for health, what one portion looks like for each food group, how to make healthier choices and use food labels, some tips for meal planning, and then also why being active is important for our health and ways to move more. And next slide, please. And so these are just a couple of examples of some pictures we've got in here. So we've got some lovely images from the Carolyn Walker Trust, which show just some examples of what meals could look like. And then we also have a real live meal plan that was developed by a person with a learning disability and their support worker, just as an example of what they had put together, which is really nice. And next slide, please. So the third topic is the third session is around is the practical stuff. How can I use this knowledge? How can I support an adult with a learning disability to eat more healthily and be more active? And so within this one, we do cover assessing mental capacity, which Justine alluded to earlier, and how that relates to decisions about weight, food, and being active. What is realistic and appropriate to achieve in terms of weight loss, challenging eating behaviors, and some strategies and discussion around how to support with some of these, and ways to improve opportunities for people with learning disabilities to make healthier choices. Next slide, please. And so this is an example of a screenshot from the third session, which is around the sort of challenging behaviors of concern around food, and it gives a bit of a case study. And this was drawn from the interviews from people who we spoke to. So this was based on you know, the challenges that carers themselves found in practice. And next slide, please. Yep, so the next slide, we're going to share with you one of the lovely videos from the Brandon Trust.
Is that working for everyone?
It's working, thanks.
Great.
It kind of slipped when I was like drinking concessively, smoking, eating like all of the pasties, all of the sausage rolls, all of those naughty foods, and I was basically in a rut. Didn't want to go out anywhere, and it was challenging.
Because I put on over, so
It was difficult to roll her at night. It was a lot of weight was on Zoe's legs, and they were very heavy.
they used to be really puffy and flaky, as you can imagine.
They used to be very dry, her skin in general. It was your decision, wasn't it?
Yeah.
She said she wanted to lose some weight. So.
I love my food. One bit I really like is pasty, sausage roll, crisp, pizza, donut.
But does that food like you?
No. Sometimes I do get a good waist, like that. Sometimes I go like that. And then sometimes it goes down and then up and then down and up. I diabetic. I got heart problem. Sore under my arm, sore leg.
It's mainly the portion sizes were a little better offhand, and I wasn't eating loads of vegetables and fruit like I should be. I stopped eating that altogether. I stopped having breakfast. Yeah, it just wasn't good. Most of it was me being grumpy and me putting weight on and keep putting on and not being able to do anything. I just felt bad with myself for letting myself go through that and not actually asking support to help me, because every time they tried to help me, I used to get angry with them. I used to snap at them when they were trying to help. They're just trying to get me to understand more. Like they're trying to suggest healthier options, and at that time I didn't want to, and I snapped.
14.
Brilliant. Thank you so much. So that's just the first of 3 videos. So within the training, you can see their journeys as they progress and the support that they've had and the changes that they made, and they're really lovely. I think they're the best part of the learning. So I think we can come back to my slides now, and I'm just going to talk a little bit about how to access the e-learning through the platform. Yeah, okay. So the e-learning is set to public access on the Learning Hub, and I see that Kim has put the QR code on there, which is brilliant. So this means that anyone with a general account can access it, so you don't need to have a full account. And you can create a general account by registering with any email address. So you don't need to be an NHS staff member. You don't need to have a work email address to create a general account. You do need to create an account though, so that you can access the e-learning. So I've just put together a few screenshots that show you how to do that, which you'll have in the slides after. Right, so next slide, please. So you start off, so I've just gone page by page, and on the e-learning platform, it asks you to register, and it tells you then what the required information that you need is, and that's it's just so the email address, the country, and current role. You don't need to have a professional role there. You can tick the option of carer. So if we go on to the next slide. So you have to enter your email address. Don't worry about the little bit of wording that says about a qualifying work email address. That's only for the full accounts. Just use any email address when you're creating an account. And next slide, please. And this just tells you that that if you do have a qualifying work email address, you can have a full account and access all other types of resources. But it says that it does allow you to have access to the learning community resources as a general user. Next slide. It then asks you to add your personal details. Next slide. And to search for your country, so you have to enter your country. Next slide. And it asks you to select your region. And then to search for your current role. But again, so for example, I put in the term public, and all of these things came up. So it doesn't have to be like a professional work role. So you could select public carer public, for example, or parent public, for example. Next slide. And then it just asks you to check your details. So check that the information that you've entered is correct. And it then creates a general user account for you and tells you success, you've created an account. And you then get an email address an email that has your username and link to create a password. And you're then able to log into the system, and you can access any of the resources that are set to public access, including this e-learning. And I think that might be it. Yes, that's everything from me. Thank you very much.